Live stream therapeutic yoga practice and cardiorespiratory function outcomes during a pandemic with adult cancer survivors. The American Cancer Society predicts that there will be over 1.9 million new cases of cancer in 2021. Advances in basic research and treatment modalities resulted in a 45% increased survival rate in the United States since 1979, and it's expected to surpass 22 million by 2030. Survival rates are increasing due to earlier detection coupled with better treatments. This has shifted the paradigm of the cancer diagnosis from a fatal disease to a chronic disease, and has contributed to increased emphasis for research on maximizing quality of life for cancer survivorship. Many clinical trials assess the effects of cancer treatments on quality of life, measuring aspects of an individual's sense of well-being and ability to carry out activities of daily living. In our primary study, we proposed that optimal quality of life for a survivor's journey be the maximum realization of the physical, mental, and spiritual aspects that comprise what it is to be a human being. Focused attention on quality of life for survivorship has increased research in complementary alternatives that involve mind-body therapies to improve symptoms, recognizing the importance of the mind-body connection. Most studies to date have involved testing one modality and/or one specific cancer population, including complementary treatments such as meditation and mindfulness-based stress reduction, yoga, and spirituality. Our team has compared yoga to other modalities of exercise in previous research. Much research has focused on improving quality of life using some form of exercise modality. Taken as a whole, results of such interventions have yielded favorable impact on quality of life for survivors, though the impact on overall quality of life is difficult to quantify. We propose to change the paradigm with a holistic approach that includes physical, mental, and spiritual intervention components, inclusive of all cancer survivors, regardless of site diagnosis or stage of treatment. With the knowledge gained to date, the technology available, and the premier interdisciplinary team we have assembled, we demonstrate the feasibility of such a novel approach as well as assess initial efficacy. This was a single-arm feasibility study of holistic approach for maximizing health-related outcomes in 29 adult cancer survivors, regardless of cancer site and stage of treatment. The intervention included a 16-week therapeutic yoga and meditation program delivered by certified yoga teachers, where the subjects participated in 3 75-minute sessions per week. The program focused on developing the mind-body-spirit connection by emphasizing attention to breath and body awareness, focused concentration, meditation, muscular strength, endurance, and mobility. We have used a similar protocol successfully with breast cancer survivors in previous research. In addition to the live class offerings, subjects were given access to digital video links that they used if unable to attend live session. The intervention also included individualized counseling on diet and exercise and supportive psychosocial support messaging based on assessment of current motivational state. Each completed comprehensive quantitative measures and a self-report within a guided interview designed to provide the opportunity for comprehensive integrative analysis of self-reported health-related quality of life on physical, mental, and spiritual functioning. For the purposes of this report, we measured cardiorespiratory function using the 6-minute walk test and pulmonary function using the forced vital capacity, the forced expiratory volume in 1 second, and their ratio. We analyzed the differences pre- and post-intervention for the outcomes described. 29 adult cancer survivors of varied diagnosis and treatment completed baseline. The COVID-19 outbreak forced changes to protocol after the first week of the program initiation. Live group yoga practices were discontinued and replaced with live stream and/or virtual practices via the BlueJay telehealth portal. The new protocol went into effect 6 weeks after baseline. After 15 weeks, 22 of the 29 subjects completed post-assessments. There was one adverse event related to the yoga protocol. The subjects were compliant with the protocol and responding to psychosocial support via text message. At completion of the study, the subjects demonstrated improved physical functioning, which was measured by using the 6-minute walk test. There was an increase of 30.3 meters walked from 451.1 meters pre to 481.4 meters post. The subjects also improved pulmonary function by 7.5% from mild restriction to slightly below normal capacity. Our pilot study indicates that holistic approaches that utilize therapeutic yoga and meditation delivered via live stream, are feasible and can improve cardiorespiratory function in adult cancer survivors. We believe that involving the patient on their path in overcoming the challenges of cancer allows for a healing story to be co-authored by the healthcare team and the patient. Many thanks for your attention, and to IAYT and the individuals behind the scenes who made this presentation and the Symposium on Yoga Research possible.